Hi, Mr. Benjamin. My name is Hillary, and I'll be taking care of you today. Now, before we begin, can I get you to verify your name, year, and date of birth for me, please? Okay, thank you for that information. So, I have a physician's order to insert a Foley catheter. And what that catheter would do, we would insert that into your bladder. And because you're unable to expel your urine, that's just going to release some of that pressure off of your bladder, and you can urinate into that catheter. So, before we begin, let me get my gloves on. And now, are you allergic to any betadine, iodine, or latex? Okay. Okay. Now, let's just get you in a flat position, supine position, and get you to a good working height for me. Raise you up a little bit. And now we're just going to begin with some basic perineal care. I'm just going to hold this up for you. And then I'm going to place this towel with me just to maintain your privacy. Okay. And I'm just going to wipe your perineal area. Okay. I'm just going to make sure that you're all dry. Just pat you dry. Okay, now that's all done. Now, before we begin the procedure, do you have any questions or anything? Okay. So let's remove my gloves. And now we're just gonna spread your legs open, so just so it can be more comfortable to you and we can maintain our sterile feel. So what I'm gonna do is I'm just gonna place this in between the legs. And because this is a sterile process, I'll need some sterile gloves. Okay, and now we got my sterile gloves on, so now I'm just going to open this carefully. And I'm going to place this under you with the shiny side down. Okay, and I'm just going to place this over your penis, okay? Okay, now I'm just going to remove all the caps off my supplies and remove the plastic. Okay, and just fluff out my cotton balls and everything. Okay, now I'm going to spread some betadine over these cotton balls to clean the tip of your penis. Okay, and I've broken my sterile field. So I'm going to wipe from the most contaminated to the least contaminated. Okay. And now I'm just going to insert some lubricant. So if you could just take a deep breath for me. 1, 2, 3. Okay, thank you for that, Mr. Benjamin. And now I'm just going to get started by inserting the Foley catheter. So if you could, just take a deep breath for me. And I'm going to insert this catheter all the way to the Y port, okay? And when I get it to the Y port, I'm going to grab it with my non-dominant hand. And I'm going to insert this so I can inflate the balloon, okay? So you may feel a little bit of pressure. Okay, now the balloon is inflated. Now what I'm going to do is I'm just going to pull on intact, so I'm going to remove my sterile gloves. Okay. And I'm going to put on some new gloves. Okay, and I'm just going to remove all of this. Okay. And now I'm just going to take this to your abdomen so it can remain intact. Okay. I'm just going to place this under the bed, okay? Because you never want it to go above your bladder because it will cause backflow, and we want to prevent that. Okay, now if the procedure is done, okay, now the procedure is done, so, do you have any more questions, Mr. Benjamin? Okay, and your call light is within reach, and if I can help you with anything, just let me know. Okay, so let me do this. Cover you back up, and I'm going to lower the bed down back to this lowest position. Okay. Okay, mister, your call light is within reach. If you need anything else, just call me, okay? Thank you, Mr. Benjamin. Hi, Mr. Benjamin. My name is Hillary, and I'll be your nurse today. So if I could, can I get you to verify your name and your date of birth for me, please? Okay, Mr. Benjamin, thank you for that information. So I have a doctor's order to take a urine sample, okay? So what I'm going to do is I'm going to take a urine sample. So I'm going to put some gloves on. Okay, and I'm going to raise your bed to working height for me. Okay, Mr. Benjamin, before I take a urine sample, do you have any questions? Okay. And you may have a question as to why that I don't take the urine from the urine bag. Well, because we want a fresher urine sample and we want more preserved urine, so we're going to get it through the tube, okay? Okay. Just let me get my sample. And let me just wipe this with an alcohol pad, just to make sure anything won't get contaminated. Okay. And we're also going to clamp this just to prevent any flow. Okay, and I was ordered to get 10 milliliters, okay? This tape is get another alcohol pad just to wipe it off one more time. Okay. And let me just remove this because I don't want to cause any backflow, okay? Okay. Okay, Mr. Benjamin, now your urine sample is collected. Is there anything else I can do for you? Can I, you have any questions or anything? Okay, Mr. Benjamin, before I go, I want to clean your perineal area of any betadine that was left there. Just let me get some gloves. That's all clear. Okay, we're just gonna let this down. And I did dry you off. Okay, just let me place this towel back over you. Now, Mr. Benjamin, your call light is within reach, and if you need anything, just call me. And do you have any questions, and are you comfortable? Okay, thank you. Bye, Mr. Benjamin. Hi, Mr. Benjamin. My name is Hillary, and I'll be your nurse for today. Now, before we begin, can I get you to verify your name and your date of birth for me, please? Okay, thank you for that information. And Mr. Benjamin, I have a doctor's order to remove the Foley catheter, okay? Now, before we begin, do you have any questions or anything about this process? Okay. Here we go. Okay. I'm just gonna place this towel in just to maintain your privacy, okay? Okay, let's just get this off for you. Okay. Let me just remove this tape. Okay, first I'm just going to deflate this balloon, okay? Make sure that the balloon is deflated. Okay, that's deflated, Mr. Benjamin. So when I take a deep breath and I count to 3, and I'm going to remove the catheter. Okay. First, I'm going to empty the urine bag. I forgot about that. We don't want to cause any backflow, okay? So I'm going to remove the urine into this cup. Okay. And I'm going to remove it by removing this. I'm going to expel it into the cup. Okay, now that's all done. Now, let me put some gloves on Mr. Benjamin. Now, let me deflate the balloon. Mr. Benjamin, take a deep breath and I count to 3 and I'm going to slowly remove the catheter, okay? 1, 2, 3. Okay, Mr. Benjamin, now the catheter is removed. Just going to get this towel in. Okay, let me pull all your close back down here. Now let me lower your back to its lowest position. Now, are you comfortable, Mr. Benjamin? Do you need anything else? Okay, Mr. Benjamin. Well, let me know if you need anything or call out is within reach. Okay, thank you, Mr. Benjamin.